Thank you everyone for joining this morning. I'm excited to introduce Sodabeh. I'm not sure if I'm saying that right. She goes by Sue Etminan. She received her Doctor of Dental Medicine from the University of Pennsylvania and then a Master in Public Health from UIC. She provided dental services at several clinics outside UIC and at Chicago Public Schools, and currently is the dental director at the Miles Square Health Center. During their time at Miles Square, dental patient volumes have more than tripled, patient outcomes have improved, and she has been instrumental in obtaining grant funding to expand and improve the dental clinic sites. Sue has led new programs that focus on social determinants of health and helping the most marginalized populations in Chicago, including cancer survivors, patients with multiple chronic conditions, and food insecurity. So it should be a really interesting talk, something we don't talk about a lot and we always forget. So go ahead, Sue, you have screen sharing capabilities.
Sure. Thanks for the intro. I never know what to do when people are like reading off your resume, but thank you. I'm so excited to work at an academic health center that's tied to specialists like yourselves, because that allows us to do a better job of taking care of the patients. So first, I wanted to say thank you for your time, and thank you for taking such good care of the patients. All of our cancer patients love the care, and they just rave about their team at UI Health. So thank you for that. I'm going to start sharing my screen. And I'm hoping this can be a little bit more of a conversation as well, because I want to know how this program can help you guys and what feedback you guys are getting from the patients as well. So we're going to start just a little bit about what do we do and what our dental services are. So Miles Square is a community health center, right? It's got 14 clinics kind of scattered around the Chicago area. And we also have one in Rockford. The Rockford patients typically don't come up to Chicago for specialty care. They stay in Rockford. We also have these kind of portable or pop-up sites that we have in clinics that don't typically allow for dental. And so those pop-up sites, we work alongside the pediatricians to get those kids seen the same time they're in for their well child checks. We offer exams, fillings, extractions, minor oral surgery, crowns, dentures, pediatric services, and we also do nitrous oxide sedation. Currently, we only do the sedation at one of our sites, but we're opening up some more sites that are going to have the same capabilities. We have seen an enormous amount of growth in our clinic in the last 3 years. I think it's over 300%. And that, I think, demonstrates the need in the community. I know there's dental offices on every corner when you drive through Chicago, but most of them don't take public aid. And most of the dentists, if they do take public aid, it's very few, like maybe a couple patients a month, or they do take public aid, but they don't offer all services for public aid patients. So I'm really excited that we are in an environment where we can do things like dentures and rehabilitative care for all patients, regardless of their inability or ability to pay. And that's a picture of our South Shore Dental Clinic. So being a community health center, this is our philosophy of care. And I don't know if you guys have seen this slide before, but I just love it because it explains, and there's actually another iteration of this slide that includes justice that was not included here, but equality is giving everyone the same size box, but you can see even the shortest person there still can't reach it. Equity is where everybody's able to reach. And I kind of see our role in the clinic is giving some of our high-risk patients an extra boost to achieve full health. Oral health has been tied to overall health outcomes, and we're going to get into a little bit of that specific to cancer patients. But we have a series of programs where we try to engage those patients that have more needs than someone who comes in that just needs one cavity filled. So so this might include like food security. This might include connecting them to social work. We do mental health PHQ-9 screenings, so depression screenings for adults when they first come to the practice to see if they score high enough. We'll do a warm handoff with our social worker on site. And I'm going to get into some of the other ones. Yeah, so we do interdisciplinary care processes that strengthen the safety net for our patients. So like I mentioned, we do behavioral health screenings. We've also noticed that diabetic patients that get continuous oral health care and a reduction of oral inflammation get better diabetic outcomes, so lower A1Cs. So we do check glucose in the dental clinic. We can offer them point of care testing when needed, and all of our dental clinics are under the same roof as our medical clinics. So if we ever need to, say, hey, you need to pop over to medical to get a follow-up with something, or if they need a refill, we're able to take care of it all in one place at the same time. And I know our patients really appreciate that. So our cancer survivorship program is also a population of focus for us. And we have noticed that our cancer survivors are oftentimes just emotionally and physically and financially just kind of tapped out by the time, while they're going through cancer treatment. And so a lot of times, they just didn't have the finances for dental care, or they just needed a little extra support to engage in the system. So I'm happy to say that we're able to offer that free of charge. So all U of High cancer survivors get free dental services at our clinic, thanks to a generous gift from a foundation. And I'm going to get into who we've helped and what we've done later, but I just wanted to kind of advertise that program. A lot of patients don't know it exists, but it's been really helpful, especially for those that are on or underinsured. So they might have medical insurance, but they don't have dental insurance, and things like that. So we screen everybody in the clinic to make sure, we do social determinants of health screening, and we really try to provide these wraparound services for everyone. We've also noticed that, with chemo and radiation, sometimes their teeth break down, or sometimes they need dental work done as a result of the cancer treatment. And so we want to be able to ensure that they can get their partial dentures or their dentures and crowns with actually no charge to the patient. So this slide was made for people who don't have as much of a cancer background as you guys, so you can kind of skim over it. But obviously chemo and radiation cause oral health effects. They get mucositis, they get sore spots in their mouths. Radiation can break down their salivary glands in their bone, and it also upsets the bacterial balance in the mouth. And so you'll get a whole lot of changes due to that. Dry mouth causes, teeth to become more brittle and to break, and they might need more work done after the chemo. And I'm going to go into what is the perfect time. Well, we'll talk about some oral complications, and then we'll get into how and where to refer to us. So again, they're going to get some patients you might have noticed said, hey, I didn't have any mouth problems, and then I got this cancer treatment, and now my teeth are breaking all the time, or my taste has changed, or it's hard for me to open my mouth as wide. So for patients receiving high dose chemo, stem cell transplants, radiation, really the best course of action is to have an oral health plan before they start treatment. We reserve certain slots in our templates for our cancer survivors. So the minute you fax us over a referral, and I think some of you can speak to it, we get them in within a day or two. It's really up to the patient as to how soon they can come in to see us, because we don't want to delay their cancer treatment, but we really, really, really want to get them in before they start their cancer treatment. Because the next bolded part is certain drugs used to treat cancer and other bone problems can lead to osteonecrosis of the jaw and some other pretty serious complications that are so easy if we just get the treatment done before radiation or before the drug therapy starts. You can see in this study right here, between 2 and 22% of patients who receive radiation to the head and neck have developed ONJ. Radiation reduces the vascularity to the bone, and the resulting side effects can be difficult to manage. It's pretty severe and it's pretty painful for the patient. Some of the medications that cause ONJ are listed: bisphosphonates, denosumab. You can go through that list. Those are the main drugs. And I also wanted to add that poor fitting dentures can also cause ONJ in your cancer patients. So even if they don't have any teeth, have them come see the dentist, because they can still get mouth sores, which are not necessarily related to teeth. We had a patient, come in and say, well, I didn't have any teeth, so I didn't think I needed to see the dentist. But really, there's a lot of other issues that could go on in the mouth that are important as well. Some of the treatment for ORN includes reconstruction with a bone graft from the fibula or the scapula. That's pretty invasive. And if we could avoid that just by getting them to the dentist first, it's definitely worth it. Again, it's bolded at the bottom. I can't stress that enough. We really want to try to get them in before their treatment starts. And the things we look for is we kind of give it a 5-year plan. If we think a tooth or something's not going to last in their mouth for 5 years, we'll just go ahead and take it out before it starts because it's not worth the complications that they may get afterwards. So these are some pictures. I'm going to give you some examples. I don't know how much you've seen this, but in this case, we only the only tooth that was taken out was the one in the middle. And you can see how ONJ can kind of spread. So it's spreading to the front, it's spreading to the back. This is a rare case where it's in the maxilla. Most cases of ONJ are in the mandible, and you can see that in this x-ray. It's a little bit, eaten out bone, but that can actually develop a sinus tract externally, and that will require a lot of extra care and treatment. So I'm going to get to this next case. This is an 82-year-old woman who was treated with tumor necrosis factors and some medication, some long-term steroids. She received prolonged bisphosphonate therapy, and then she developed bilateral osteonecrosis of the jaw. And you can see in picture A, there's like a little bit of a sinus tract externally that had to be treated. So it was quite painful for the patient. And, they gave her antibiotics and everything, and the sinus tract still persisted. And they did have to do a hemisection of the jaw, which is obviously very difficult for the patient to go through after cancer treatment, because when you have a lot of pain in your mouth like that, it's not like you can stop talking or stop eating, right? You always have to use your mouth generally. So that's why mouth pain, tooth pain can be especially painful for some patients. Show of hands, you guys can use the hand. How many of you guys have heard of the Pentaclo treatment, or do you guys use it ever? Anyone? So these studies have come out as it's fairly recent. There's some really good studies that came out in 2020. It's called Pentaclo, and it's basically pentoxifylline, tocopherol, and cladronate, and it has shown to resolve radiation-induced fibrosis. So in case we do take the teeth out after they've had radiation or bisphosphonates, and we are noticing something, if we notice it right away, we're going to send you guys a message. Being part of the dental team, I typically try to abstain from prescribing any kind of systemic drugs that may interact with what they're already taking. I'll shoot that back to their PCP, and then we'll loop you guys in as well. So it's a long-term, it works as a long-term, medication. They start with a 28-day phase of the antifungal and corticosteroids. And they basically just keep taking it up to 2 years until they see some kind of result with the radionecrosis. And the 2020 study showed that the exposed bone area was decreased after just a couple of months. And after 24 months, 92% of the exposed bone had decreased. So it's definitely something. I know there were a couple of cases that we shot back to you guys. We CC'd you on the Epic message that we included their PCP on to see if the patient could go on this, because we were noticing some exposed bone and delayed healing after the extractions. All right, let's go back. So there was another study with the Pentaclo for previously irradiated patients. So 54 patients that were previously irradiated for head and neck cancer had noticed some mandibular radionecrosis, and they tried, surgery. They tried the hyperbaric oxygen, which is historically the course of treatment. All patients were given daily oral Pentaclo, and this is the dosages. You see it's 800 milligrams of pentoxifylline, 1,000 IU of vitamin E, and 1,600 milligrams of cladronate. Alternating with the prednisone and the Cipro. And they saw that prolonged treatment was safe, well tolerated, and they did recover in a median of 9 months. So it is safe, it's effective, and this is really exciting because it's another option for patients that come to the dental office maybe after they've started their cancer treatment. And that was, the journal articles are listed down there. So I wanted to talk a little bit about what we've done so far with our cancer program and what we continue to do, and get some of the feedback from you guys about how we can serve you guys and your patients a little bit better. So far, 306 cancer patients were treated at no cost to the patient. 17 of them had received treatment prior, received dental treatment prior to bisphosphonate therapy, which is awesome. We want to get more than 17 patients in before they start their bisphosphonates. 142 patients had a history of chemo, and 100 patients had a history of radiation. which can obviously cause adverse intraoral effects. And these are some of our patient demographics that we've seen. Pretty much gender distribution was about half and half. And our race and ethnicity, the green is the Black or African American, orange is unspecified, and that rust orange color is the Hispanic Latino. And we had the light brown is the Caucasian, and then we had Asian Pacific Islander in the yellow. I think this is a good breakdown just to kind of see where we're at and the patients that we are helping. And you can see that 99% of our patients are within 200% of the federal poverty limit, making them low income patients based on federal guidelines. And those are the patients that we really want to reach out to the most. Things that we also do is, so these are a couple of our patient stories. You might recognize some of these people because they are your patients. This top gentleman is someone that we made his dentures for. He was saying, after my cancer, I was hurting all the time in my mouth. I couldn't eat, I couldn't sleep. My teeth were breaking when I was eating soft food like bread. I didn't feel anything when he took my teeth out. I'm not in pain and I can eat again. So we gave him a full set of dentures. And this picture was taken, the dentures were in the process of being made. This was one of the try-in visits. So he wasn't quite ready to smile just yet, but I'll have to update this photo with him with his new set of teeth. And we're trying to get him in to come in every 6 months to be seen, because even though he doesn't have any teeth, even with the sore spot, if he does get any sore spots or blisters with the dentures, that could lead to ONJ, and we want to make sure that that doesn't happen. This was another lady that we did see. She ended up losing her back teeth as a result of the radiation. She couldn't chew. She needed 5 teeth taken out, and you can see that they were all really concentrated on the right side at the top of her mouth. She could not afford the partial dentures on her own. Insurance and Medicaid typically don't cover partial dentures. They want you to take out all the teeth and do full dentures. That doesn't obviously, make sense for a lot of people, especially her. You could see the rest of her mouth where the radiation was not concentrated. She had a full set of teeth. So we wanted to just replace the 5. And then you can kind of see in that picture, she has a full set of teeth again, and she was really happy about that. The other thing that we do for our patients is if we can get them in before, again, that they start this therapy, we can make them fluoride trays, which is almost never covered by insurance. And we can give them fluoride trays to wear while they're undergoing their cancer treatment. And that has led to improved outcome. That has shown to lead to improved outcomes as well. So the only site right now that can currently see our cancer patients is our South Shore Clinic that's located at 71st and Stony Island. I know it's pretty far, but we actually have some cancer patients that come in as far as Bloomington Normal for our dental services, and they come in just as far to get the cancer services from you guys. We try to get our cancer patients in right away. It's typically easier if you guys fax us or email us the referral sheet that you have. I'm going to provide that referral sheet at the end of this presentation so that you can get fresh copies if you need it. When the patient calls us, if they don't tell us over the phone that they're a cancer patient, we wouldn't necessarily know to prioritize them. And that's why it's a little bit easier when those referrals come from their medical care team. Some things I'm really excited about. So we have seen such an enormous amount of growth. South Shore is well over capacity. And so we were able to get some approval and get some funding to open some new clinics to respond to the increased demand in patient care. We're opening a 6-chair clinic in Auburn Gresham. For those of you that aren't familiar, it's basically 79th and Halstead. That's going to be open in just a couple of months. We're going to get another 4-chair clinic at our back of the yard site that's located around 46 in Ashland. That's going to be the closest site to where you guys practice. So that'll probably be the site where we'll send most of your patients. And then we're going to get another 4-chair clinic at the UI Health Specialty Care Gage Park facility, which I believe Hema-Onc will also be included in that facility. And I'm really looking forward to practicing under the same roof as specialists, because the Mile Square clinics typically have, just family, primary care. So hopefully we can get more of a relationship and more interaction when we're physically located in the same space. I believe the medical side is already open at Gage Park, but the dental side has to do some minor construction. So we're not going to be open there until probably September or October of 2022. And all of these sites are going to be fully outfitted with things like sedation and dentures and everything, so they can also care for the cancer survivors as well. All right, so this is how to refer patients to us. And I'm going to check the chat. Perfect. Oh, I'm just looking at the chat right now. I'm going to get to that in a minute. Those are really good questions. So I hope all of you have seen this referral before. We've given out copies to the cancer care team, but if you guys need another copy, I can send it to Dr. Manst and she can send it out to you guys. You have to fax, unfortunately, you guys have to fax or email this referral to our department. The fax and the email information is on the referral. You have to give us the patient name and Epic MRN with the date of birth. And you also have to write down the contact phone number for the patient. Our dental team is not in, we don't use Epic. We use a different software. So while my providers, like the dentists, have access to Epic so that we can look up their medical history and we can message you guys as providers and we can message the primary care team. However, our appointments, our records, none of that stuff is in Epic, and my scheduling staff likewise does not have access to Epic. So if you give us the MRN, my scheduler doesn't have access to Epic, so one of the doctors is going to have to take time out to look it up. So it would be so much easier if you just stick the phone number on there or stick a patient label on there. And it would be really, really helpful if you guys also fill out, when you guys write down the bottom, and we try to make it as easy as possible, just put down the name of the nurse who's sending it. You guys have usually been pretty good about that. Write down cancer or hemonc for health concerns. And if it's urgent, obviously mark urgent. And so that way we can kind of help stratify, because like I said, our scheduler doesn't have access to Epic, so they're not going to know it's a cancer patient if you don't write it down on this referral form. We do have a phone number. I believe my team has been in touch with your team quite a bit about some cases that we've been co-treating. Our internal number is the 55570 number that's at the top. Please don't give that to patients. If patients want to call to make an appointment, they call the main Mile Square line to get in touch with our schedulers. But again, for our patients that we're stratifying based on risk, I really prefer to get that internal referral, because that information may get lost over the phone if the patient doesn't, tell us, hey, like, Kristen and Dr. Manst are treating me, or however, if they don't let us know that, then we don't know to put them in one of our cancer care slots. All right, so let's get to some questions. I'm excited that some of you are going to be at Gage Park. Yes, we do take care of pediatric cancer patients and pediatric cancer survivors. We haven't had too many of them. We have had some. Some of them we actually treat with La Rabida, because that's like closer located to our South Shore site. So some of them come from not UI Health. We also have a GVHD clinic for graft versus host disease. We have a couple of those patients as well. And we've worked on that in conjunction, because Rush has a GVHD clinic, which I believe some UIC providers are also part of. If there's anything that goes above and beyond our scope of care, which sometimes it does, we're just general dentists, we refer to the fabulous oral surgery team at UIC, and they kind of help take care of things. I will let you know, for any ONJ cases, there's 3 people that go out on that Epic message. It's you guys, the primary care doctor, and we also loop in OMFS, just so they're aware in case a patient pops up on their radar, they know what's going on. Again, we do that because you guys unfortunately can't see our imaging, you can't see our notes, and you can't see what we talked about with the patient in Epic. So we want to make sure everybody knows what's going on and what we're doing. I can see your clinical information in Epic. I just can't do a whole lot with it. So we basically take that clinical information in Epic, we print it out, and we manually scan it into Dentrix. It's tedious, and I hope someday soon that UI Health moves the dental department over to Epic as well. That's one of our goals for the next 3 years. And Dr. Sue, I'm so excited that you will be at Gage Park. I can't tell you how like thrilled I am to be working, because we do stratify patients based on risk, and to be under the same roof as some of these specialists. I really think a lot of these relationships happen organically. When you see people, it's kind of hard to blindly message someone that you've never met before. I know having Dr. Manston, the cancer survivorship program at Mile Square, has helped us forge this relationship. So I'm excited to be under the same roof with more of you guys. I think that'll lead to some better outcomes for our patients and more of a relationship. I also wanted to, at this point, can you guys tell me, is there anything else we can do that's a little bit different? You guys can take yourself off mute and we can kind of have a conversation. Some of your names look really familiar. I know we've talked with you guys before. Anything we can do? Go ahead and share.
Yeah, thanks, Sue. This has been just so helpful. And, it's great to see, firsthand images too of how helpful this is for patients. It really is. And it's something that, is really downplayed and is really not something we pay attention to. But I always try and make sure I ask, are you regularly seeing a dentist? Do you need help with your dentures? And it's definitely something patients are like, wow, these services are free. What? And one issue that I've had come up with patients that I wanted to ask you is South Shore. I know you're expanding to other sites and we're waiting for that. And I tell the patients, I'm like, they're on the way. But parking at South Shore, is there any solution for that?
I am so sorry. So we are completely boxed in by railroad tracks and a U-Haul company, like the U-Haul store. And we share our building with a daycare. So if your appointment is during daycare drop-off and pickup, that parking lot is a zoo because there's parents coming through to pick up and drop off their kids. There's usually high turnover with those patients or those people because they're in for 10 minutes, pick up their kid and leave. But our parking lot is a mess, and most of it is caused by dental patients because we are so beyond capacity, right?
Right.
So just to let you know, to make things easier for our patients, our South Shore clinic is open on weekends and evenings. And we did that in response to, we just didn't have enough chair time, right? We were booking, 5-6 months out. So we did extend our hours, and that has alleviated some of the stress a little bit, but I cannot wait. Auburn Gresham is going to be even bigger than South Shore. And so I'm really excited to get that. And Auburn Gresham is going to have a much larger parking lot.
Great. And how
So
many chairs?
Yeah.
How many chairs are at South Shore?
South Shore only has 4.
Okay.
Auburn Gresham is going to have 6. And we have another 3 chairs in Rockford in case any of your patients are out. Because I know some of your patients drive in from like Elgin and Schaumburg and stuff. It might be easier for them to get into to our Rockford clinic. And so, yeah, we're really excited. And then 2 more 4-chair clinics around the corner as well.
Yeah. I have one other question, see if anyone else has a question too. This donation, I mean, it's very magnanimous of this donor to support this program. Is it like an ongoing support thing, or is it, how long is funding for this going to happen?
I am really excited that you guys are on this, that I'm on this call and you guys are giving me the time, and I would love to give you my little pitch. So the fund on this program is running a little bit low, and it was so generous that it came as a gift. What I would like to do and what I'm asking for your help in is if anybody wants to collaborate and kind of basically transform this into a research project, because at first it was a philanthropic project, which is amazing, but philanthropy is hard to sustain. And so, and I think it's a disservice to our patients when we don't analyze that data and look at that data, because we can then help more patients if we have, that background. So if anyone has a background in research and wants to collaborate with me and with our other dental team members and see and ask some really pertinent questions. Something I would like to push for is survivorship improved? Is quality of life improved with dental rehabilitative services? Because if you think about it, we're really lucky. But why are UI Health cancer patients getting this care and not the ones that go to Rush and not the ones that go to Northwestern? I would love to have this project grow into something bigger that includes policy change, where if you're a Medicaid patient and you have a cancer diagnosis, we're going to give you extra dental services. That would be my main goal, is to have this risk stratified approach to public aid. That's kind of like my little evil plan here, but I would like to get your your help with this. And you guys are really the experts at this. We just offer the dental services, and we can help, push the policy needle forward, but we need your help on that. So if anybody wants to work with me, if anyone sees any opportunities, I'm all ears. So please let me know.
Yeah, it might be worth getting in touch with what's her name? Can someone help me with her name? Marion Fitzgibbon. She works a lot with a lot of research and grants, and might have some pulse on some programs like American Dental Association, and I'm sure there's funding that can be dug up for this for people that want to engage with Sue. Let her or me know for sure.
There's some questions in the chat too.
Yeah, Megan asked, can you email the dental referral form? I know it's kind of inconvenient to fax.
Nope, there's an email address on there. We actually created an email address, mshcdental@uic.edu, for all of our schedulers. It gets checked every morning, so you can email it to us or you can fax it to us, whatever's easier.
Awesome, that's awesome. And there is currently an ambulatory referral to Miles Square Dental in Epic, but it doesn't land there yet. So once that link is established, that'll be active, but don't be misled by that. Because I'm like, wait, there's a referral and it's not active yet.
And there's someone sent me a direct message about what insurance we accept. So I want to kind of get into this. If they are a cancer survivor, we will see them regardless of insurance status. Does not matter. Obviously, we have to bill their insurance if they have insurance, but for any services not covered by insurance, basically the bill just goes to the grant. So they don't even see a bill, they don't have to deal with it. If you are not a cancer survivor, we take Blue Cross Blue Shield, MetLife, most of the MCOs except for Meridian. So if the patient has Meridian, unfortunately, we are out of network with them. And we do treat patients that are undocumented. That's the Miles Square, that's the policy. So we don't require any kind of papers or anything like that. And I can email this group the dental referral form, absolutely. And I can send that to Dr. Manst after this presentation so that you guys can, or you can even just print it straight from here. Or I can email it to you, whatever's easier.
Yeah, sending an email to the group with the slides would be great.
Yeah, and I love it. So thank you. If there's pediatric young adult angle, yeah, that would be really great. Our numbers, like our size for pediatric cancer patients is very, very little. Most of the 300 patients I want to say are adults. So we don't have a whole lot, but that doesn't mean that isn't an opportunity for growth. So if you think that there's a need, let's try to get it together and let's figure it out.
And there is a pediatric cancer survivors program. So the kids who were treated and then have survivorship, goes into many different ages. So with Dr. Leslie Jabine, we have a program for that.
Yeah, Jessica Intner was going to join this talk this morning. So that will definitely forward this along to her. Get in touch with Jessica, Dr. Sue, and she may be, because I'm sure that's something that they address regularly.
Yeah.
Sue, do you
20 feet away from mine?
Sue, do you know Dr. DiPietro in dentistry?
I know the name.
She's a member of the Cancer Center and she's a wound healing expert. So she's got a ton of grants throughout her career, and so that might be someone just to bounce some ideas off of.
What is that again, Sam?
Louisa DiPietro.
And is it DEPI?
DIPIETRO, I believe. LUISA.
Okay.
Is her
great. That's great information,
really
Sam.
Good. We have a unique, so my team of, my dental team at Miles Square is a little bit siloed because we are employees of the hospital and we work because of being our affiliation with Miles Square. So we have we have a 0% courtesy appointment at the College of Dentistry, but our practice sites are not on campus. So we never get to go down there for meetings or anything. So I would love to kind of strengthen that connection with the College of Dentistry, but most of the time the dentist that's in the building is the only dentist in the building. And so we collaborate more with the primary care doctors just because that's the way Mile Square is set up. But always looking for ways to meet with other dentists that are doing similarly aligned work.
Great. Wow. Well, anyone else have other questions in the chat or directly? This has been
And
really
my
great.
contact information is the next screen. And honestly, if someone needs a little extra help navigating the system, or if somebody's receiving information that may not seem right to you, if they're being turned away, not that they should, but this is my contact information. Send me an email and we can make sure, like a lot of our patients need more personalized kind of case management or navigation. And we can try to, take that into consideration when we're helping them make their appointments.
And anyone on Epic or pass the information along, obviously Sue's very contactable by Epic chat as well. If we have a case patient that we have any question about, we can forward it. And yeah, it's completely true. We've had a couple of patients that are like, oh my gosh, I'm having this dental problem, and we get them in the next day at the latest. So it's a really wonderful service.
Yeah, I would say email is probably a little bit easier because we're not always on Epic.
Right.
We check Epic kind of in between patients, but our emails are always open.
I've always been able to get a hold of you though, so you're very responsive.
I'm always on Epic, but not all of my providers. Like if there's a different provider that's treating the patient.
Yeah, I just was so you can't manipulate the chart at all, like enter in any documentation at all. That's such a bummer, but you can chat.
I can chat, which is I requested the ability to chat because I was like, I'm not going to email, everyone and we're gonna be on this because we work under the same roof. But there is no dentist access in Epic yet. So I'm a referral coordinator or a research coordinator or something until we get it figured out.
That's also the problem with the OMFS. I see very sparing notes from Yvette and Dr. Callahan. I'm like, did they see OMFS? So, because I will refer to them as well. And OMFS for everyone is oral and maxillofacial surgery. And so they partner with us in a lot of like head and neck cases, survivors. I'll talk with them about certain things too. So just to clarify, Sue, so everyone knows, at any time, refer a patient to you guys, right? Like there's no limit to the spectrum of cancer care, pre-cancer care, pre-cancer treatment. So these patients are eligible to be referred to Sue at any time, even before they start treatment.
We would actually rather see them before they start. So that would be, and we've educated our primary care providers in the facility, the same thing. I believe I can't remember the name, but somebody's been sending me, you guys take Panorexes at the hospital. So someone's been sending me Epic chats with those images to kind of evaluate them to see if they need to come in or not. That's been helpful because I could take a look at it and be like, yes, they need to come in, or you know what, this can wait until, whatever. So especially for those patients that have a hard time getting down to South Shore. So I can't remember the name. I think there's a couple different nurses that have been sending them to us. So thank you. Thank you for starting that.
It would be great for you to connect. Have you ever been in touch with Amanda Rivera? She's coordinator of the oncology fellowship, Hem-Onc fellows. So you should definitely talk to them because they would be the ones at the front lines with cancer patients when they're diagnosed. Radonc and Hem-Onc fellows would be prime target for a talk like this. It would be perfect for them.
Great. Yeah, send me all the information. I'll definitely
I'll connect you guys so that you can talk there, because this is fantastic and a little known resource. I tell people survivorship, I just told my nurse, Kristen Anderson, this where she's like, what? They're free. No one knows. So
yeah.
Thank you, Sue, so much. Perfect. I like the kind of focused, targeted talk. If no one else has any questions, we can end a little early. And And yeah, send out that form and the slides. And once the recording's ready, I'll get it posted for anyone if they want to review this. I'll also put the referral form in the folder with the survivorship lecture series documents. And yeah, great. We'll see you guys all next month.
All right. See you guys next month. Thank you. Thanks for having me.
Okay.
Thank you.
Bye.
Bye.